In the early 80s, a very mysterious new disease appeared that was reported to cause the devastation of the human immune system.
We at first didn't know what was causing this problem. There was nothing we could do at all. We had good tests. We could identify the patients, but we had very little to offer.
HIV was considered a very ugly disease. When we started saying that children can get it, that upset people. And they didn't want to believe it, because if a child could get this disease, then anybody can get this disease.
Perinatally infected children are ones who became infected during pregnancy or during delivery or shortly thereafter by breastfeeding. At the time, I would have never imagined that we would be at this point where we have, in our clinic, zero transmission for 20 years.
Well, my name is Carmen and Elia. I am HIV positive, and this is my fiance.
My name is Horacio Diaz. I'm the fiance.
We've been together, I would say, a good 5 years.
And I have her back and she has mine.
I am 9 months pregnant, and I'm currently going to Dr. Steck. She's very, very good doctor. Everything's going great.
I'm excited. I feel anxious. I just can't wait.
So what's your husband doing?
He's working, and he just started today. Otherwise, he would have been here. He wanted to be here. It's very exciting.
We're gonna go over to the other room then,
Awesome.
and I'll let the doctor know you're there.
Perfect.
You got it?
Yeah.
I'm Alice Steck. I'm an obstetrician, actually a specialist in maternal fetal medicine. I gave myself the title of the Director of Perinatal Services at the Maternal Child Adolescent HIV program here at LA County, USC. We provide a sort of comprehensive services for the entire family. Being pregnant is stressful. Being pregnant with HIV is extra stressful, and we'll try to provide you with support for that. The chance of the baby being infected is less than 1% if they can comply with the regimen.
So what do we now know about HIV? HIV is a retrovirus, meaning it cannot replicate on its own, and instead it makes copies of itself by infecting cells. Inside the viral particle, we can see the capsid, seen here in yellow, which is a protein shell that surrounds the RNA genome of the virus. An HIV particle is typically around 130 nanometers in diameter. For scale, here is the HIV virus next to its target, a T cell. The HIV life cycle begins with binding to the T cell. T cells have CD4 proteins on their surface. HIV's envelope protein targets and adheres to them. Next, extensive conformational changes in the envelope protein cause the membrane of the virus and the plasma membrane of the T cell to fuse. The fusion of the two membranes releases the contents of the virus into the cell. Once inside, the capsid travels towards the cell's nucleus. But before HIV's genetic material can enter the nucleus, it has to be converted into DNA. The enzyme reverse transcriptase converts the HIV RNA into HIV DNA, using the cell's own nucleotides to build the double helix. Once completed, the viral DNA strand can now enter the cell's nucleus. The enzyme integrase inserts the viral DNA into the cell's DNA. The virus then uses the cell's machinery to build new viral proteins. The newly created GAG proteins, seen here in orange and yellow, cluster together with the viral RNA, the blue string, at the cell's membrane, forcing it to bulge out and form a new immature virus. Protease then clips these GAG proteins into their shorter, functional forms. Once the virus is fully matured, it is then able to infect new cells. The virus is now free to move to different T cells and infect them, repeating its life cycle again and again and again.
Well, here's the crib. It's the first crib that I built. And I struggled with it, but I made it possible. I made it possible. I even put it on Facebook. I built my own crib. We got the little baby shower gift that we got. And we're ready. I'm ready. We're ready. I just can't wait.
Can we talk while the blood is being drawn? Or is it distracting?
It's probably good for her to
Probably
be
good to be
distracted.
distracted. Okay.
Good morning, Dr. Chris.
Good morning. We're going to look at the platelets, of course, which have been good, but it's been 4 weeks, so it's time to look again. 191. Wow, they haven't been
Yay.
that high for a long time. That's
I know,
great.
and solo.
So we're going to check again, and although your viral load was fine 4 weeks ago, the pediatricians always want one close to delivery, and you could go into labor in like another 2.5 weeks or so. So let's get one today. One of the most important laboratory tests that we use in managing our patients is the viral load. It measures the amount of virus in a quantity of blood.
Without proper anti-HIV medication and treatment, HIV uses the body's own machinery to replicate itself, creating high levels of HIV particles in the bloodstream. Proper anti-HIV medication prevents the virus from replicating, bringing the amount of virus in the blood to our target level, which is undetectable.
We monitor the viral load much more closely because the consequences of having an increased viral load could be transmission to the baby. So how are you doing?
Doing good. I mean, just anxious and been a little bit in pain the last couple of days.
Where?
Like pelvic pain. So I even took a shower, just in case. Just in case I'm ready.
We didn't really see any contractions on the monitor, but if the baby isn't moving well, then you should go to the hospital the same day. Any difficulty taking your medications?
No.
Very good. Okay. The introduction of good medications, women can expect to have a good outcome of their pregnancy and can expect to remain in good health and raise their children. It's completely changed over the course of my career. In the early 90s, the first study to show that there was something that we could do to decrease maternal-child transmission was a study of AZT during pregnancy.
We were able to convince the new government agencies that were supporting early research in AIDS to allow us to give pregnant women AZT. And I remember the first baby that we gave the mother AZT, and that baby wasn't infected.
This regimen of AZT during pregnancy and during delivery and to the baby for 6 weeks, we were able to reduce transmission by 2/3. That was really, really remarkable. The people who are in training now, they have no idea what things were like then. I don't think there's really anything in medicine that has experienced such an enormous change in the span of my career. Good. Well, let's first have a look at the fluid around the baby and look at the baby's position.
Okay. Okay.
This is the head. Can you see it on that little screen? It's a big round thing, biggest part of the baby. How long do you plan to work?
And maybe like 2 more weeks.
Yeah, some people work up until the day they go into labor.
That's what happened with my first. My first child. It was an easy pregnancy, to be quite honest with you.
She drove herself to the hospital. It was amazing.
Yeah. I found out, that I was HIV positive prior to me being pregnant. I thought, honestly, I was going to die like within 2 weeks. So I said, okay, that's it. And I remember I had gone to a clinic, and I asked the lady, the nurse, I said, you know what, since I'm HIV positive, does that mean the baby's going to come positive? She said, well, yeah, because if you're sharing blood, of course he's going to come HIV positive. And at that moment, I remember breaking down. Sorry. Because I don't want that for him. And once I went to another clinic, then the doctor was like super optimistic, and he was like, no, it doesn't mean that's gonna happen. You just have to take some medicine and you guys are gonna be fine. So sure enough, I did that, and luckily my son was negative. Now with this pregnancy, I'm just happy, and I know everything's gonna be fine.
Pretty close. If you go into labor now, it would be okay. The baby would do well.
Yeah.
Has the baby been moving well?
A lot.
Every day?
I know last week she had flipped, so she was breached, like head up. And on by Thursday, she had already flipped again.
Oh, good. Most likely, she will stay head down.
Hopefully.
They pick the best. You know, the head is the biggest part. It's round and fits in the pelvis. You probably feel
Do I?
pressure. All right. The baby's heart rate looks great.
Awesome.
Okay, it shows all the things that we need to see. It looks like the baby's been moving well, and there's not many contractions. So
Yeah.
last time you were here was 2 weeks ago, and we did some labs. So let me review those with you. Okay. The most important one is the viral load, which was undetectable, and your platelet count remains really good, 146. That's great.
That's awesome.
Yeah. At the end of the pregnancy, it's the most important that your viral load remain under good control. But you're tolerating the medication, okay?
It's just that at times it kind of feels like I'm taking a lot of pills.
Well, you are. But I think they're all necessary. Carmen, her antiretroviral regimen includes Truvada, which is a combination of tenofovir and emtricitabine, atazanavir, boosted by ritonavir.
Anti-HIV drugs work by targeting normal HIV. HIV contains critical components known as enzymes that carry out the chemical reactions that are required for the viral infection to occur. In Carmen's case, this is an example of how the multiple drugs can actually target different parts of the virus. So Truvada is a fixed-dose combination of 2 reverse transcriptase inhibitors that are known as nucleoside reverse transcriptase inhibitors. The components of Truvada mimic the normal DNA building blocks, but once they're incorporated, they block further extension of the DNA chain. Reataz is a protease inhibitor whose activity is boosted by Norvir, another protease inhibitor that can block the cutting action of the protease and cause it to not be able to lead to maturation of the viral proteins.
And I have to take those daily so that I can keep my viral load undetectable, and therefore it will not transmit to the baby. I wasn't taking medicines for a long time after my first child because I was in such denial because I felt good. I didn't feel sick. I didn't feel any type of symptoms. And I got together with my fiance and I started taking them again, you know. I just want to make sure that he's going to be okay.
And I'm fine. I already checked myself and I'm okay.
You're having contractions, you feel the baby heat, right?
Yeah.
Any problem with depression?
Just anxiety. Frustration.
Tiredness. We're gonna get this baby out one way or another, Carmen, don't worry.
I know, I told you I'm going to serve you your eviction notice.
Last time you were here was 3 weeks ago.
Wow.
Yeah. And how have you been doing since then?
Just exhausted.
Well, that's to be expected. You're
Yeah.
already past your due date.
I know.
Well, we don't like the pregnancies to go beyond 41 weeks,
Okay.
which it would be
Saturday.
Yeah. Right, so I'm suggesting that we admit you for induction, if that's still what you want.
Tell me where to sign.
Because at this point, most women are kind of tired of being pregnant. And who knows, maybe you'll go into labor on your own before then. That would be the best.
That would be the
But
best.
yes, and we really want you to come to our hospital for that. Because we know you, the neonatologist, will know what to look for in the baby as far as exposure to the medications, exposure to HIV, the low platelets, because the baby is at risk of low platelets too.
Yeah.
It would be by far the best if you could come here. Let's have a look before we talk any further.
Okay.
Good, but if it's successful. Well, I think the patients understand that people who work in our clinic really care about them. You know, of course, we want uninfected babies, but we want healthy mothers. I hope that comes through when they come to our clinic.
Oh, look how cooperative.
She doesn't have that much room to hide now. I had like no complications whatsoever in my first pregnancy. I found somebody that was a really good doctor. He was a really good doctor, and he really took care of me. So I'm thankful, and I'm glad that I didn't just give up, you know, and that first visit. That it still resonates. But I'm hoping that if she's still there, that she has gotten more information and that she's updated. So that way other women don't have that fear. Luckily, I started looking for a second opinion, so. I consider myself very fortunate. Very fortunate.
This long girl. I'm just gonna go for the smallest amount of lab, okay? We're not gonna do all, we'll only do the one test.
There it is. There it is. There it is.
It's okay, Mom.
Sorry, Mom and Dad.
No worries.
No, you know, it really helps when the parents are calm. You have no idea how much that helps. Good, calm parents here. Don't worry, she's not going to remember. So this is her second DNA test, and I want you guys to know that the first test was negative. We have the results, so that's good, right?
Right.
So today's the second one, and then we'll do another one at 2 months and at 4 months. So we got the blood that we needed today. All right, questions?
Thank you.
You guys are doing good? Okay,
Thank you.
great job.
Thank you.
Thank you.
We went from a program with lots of children with HIV in a relatively short period of time, having no new cases. In fact, in the last 2 years, we haven't had a new case of a baby infected, because if we can make sure an HIV pregnant woman receives appropriate care and gets the kind of care that would prevent transmission, we could really eliminate perinatal HIV infection. We've overcome a disease, put ourselves out of business, but it's a business I'm happy to be put out of.
I've been positive for 18 years. So, and I'm still here, and right now the viral load is undetectable. So they said that's amazing. And make sure if somebody tells you that the baby is going to be born positive, don't believe that. Do not believe that. There's a lot of help. There's a lot of prevention, and
It's not the end of the world.
it's not the end of the world. You're not going to die in 2 weeks. You're going to be fine. You and your baby are going to be just fine. I know.
In our clinic at the Maternal Child Adolescent HIV program here at LA County USC, We provide comprehensive services that address not only the medical issues, but the social issues and housing and nutrition and psychiatric support. The patients are seen individually by the different providers, but we try to coordinate that so they only have to come once. And we collaborate and confer a lot with each other. So we get a full picture of what's going on with the patient and plan their care. Very often, the social situation is more difficult to deal with than the medical situation. These women need a lot of extra support.
After the diagnosis of HIV, I didn't want to even have treatment. I was being very stubborn. I'm gonna like beat it or something. They're gonna take my test again, my HIV test, and it's gonna be negative. It's like, it was something that I was just, it wasn't real. So I decided to come here, and this place has really, really opened their doors to me.
You feeling okay?
I'm feeling great. For the last 19 years that they've had this clinic open, women who take their medication as prescribed, none of the children here have been diagnosed with HIV. So it's really like something that I'm looking forward to. You know, giving birth to an HIV-free baby. You know, she's great.
How are you doing today?
I'm good. How are you?
Good, good. So have you felt the baby move yet?
Yes, I have. Not so strongly, but yeah, I could definitely tell.
I have good news about your labs, right? You're taking the Complera
And
once a day and the raltegravir twice a day, the Adherence.
the Centris.
Twice a day. They've been working great because your viral load a week ago was undetectable.
You can't detect HIV?
And it doesn't mean that the virus is gone, but it's fully suppressed. This is exactly what we want.
Exactly.
So the medications are working great.
That's great.
And so I think we should simplify the regimen by getting rid of the Adherence, continuing only the Complera. Okay?
That's great. That's great.
And then we'll check again in a month or two and make sure that it's still fully suppressed.
Okay.
This is what is going to protect the baby from getting the infection from you. The risk of transmission is less than 1%.
Yeah, and as long as I'm good, I'm stable, then I shouldn't even touch the baby.
Right, if you don't have much virus in your blood, there's not much to transmit to the baby, right?
Right,
So
right.
that's good. I think we should have the social worker talk to you today. It's important that you're able to take good care of yourself and you don't relapse.
Right. Yeah. I'm still sober. Yeah.
Great.
It's been about 80-something days since January 29th, so it's been great.
Great. I think that's really impressive. Okay. Well, good.
Thank
I'm
you
glad
so
everything's
much,
going so
Dr.
well.
Sharp. Thank you.
All right.
Thank you so much. I'm gonna be okay. Be okay.
Lourdes is going to draw your blood.
Okay.
Okay? Because I want to make sure that your viral load is okay.
You okay?
Yeah, I'm good.
You can relax your hand. Elia, 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 Elia.
Okay, yeah. So that's what I'm gonna name the baby. My name backwards. Aile.
Yeah, that's so cute.
It's my name's Elia, and then backwards Aile, and it's Latin. It's wings. Aile.
So cute, huh?
Aile.
Are you working on your car seat?
Yeah, everything should be taken care of. Yeah. I know that you said you can get everything.
Everything, yeah. But you work on the car seat. I can't,
Yeah.
because that one we can't guarantee. I don't have a whole lot of girls' clothes. By the time you deliver,
I always appreciate things. I always do. I appreciate it.
there's all kinds of stuff for you. Okay.
I was homeless for 2 years, and I got spiraled into that whole everyday living, which included smoking methamphetamine. My then boyfriend was having intercourse behind my back, and so that's how I contracted it. He is the father of my unborn child.
The feet, the lower legs, the knees. There is a normal heartbeat.
There is a restraining order because it wasn't the first time he had struck me, hit me, or verbally abused me. It had happened before. My situation with me being homeless, it's soon gonna come to an end, or I can't stay much longer at my friend's. My time is already up. I need to get out of there. It's not,
The social worker could help with something temporary, like some sort of a shelter or temporary housing of some sort. We want, at all costs, to avoid you going back to the street.
Right.
We can't have that.
Hopefully, this will clear out soon.
And the HIV medications here, let's make sure that I have it down correctly. We decided that we could discontinue the Icentris, right?
Right.
So you're only taking Complera. That's the one that you
Right.
can't miss.
That's the one I haven't missed a dose.
Good. I think it would be helpful to make sure that the viral load is still undetectable. It should be. Based on the genotype and your good response to the treatment, it should be undetectable still, but let's make really sure.
Yeah.
Okay, great. And the issue of your partner, the father of the baby, is he still...
No, he still have that restraining order.
Right.
Protective order,
Right. So you're safe, right?
I'm safe, Okay. I'm good.
Good. Based on my experience with patients with all these social issues, with psychiatric issues, with long-term homelessness and substance abuse and alcohol and domestic violence, I'm worried that she will return to that environment. I think that would be very tragic for her in particular, because it looks like she's on the path to doing well.
I was living right up there with the tent, and unbelievable. It's really, really hard to come back, and that's where my daughter was conceived. It's so strange. Hi. Yes, V. Yeah, everybody knows me here. It's crazy. Hi. Hi. Yeah, I'm gonna have a baby girl. And a lot of things happen, a lot of negative things happen to me, but it's all for like positive. Exactly. I got diagnosed with HIV. I got HIV. And I don't think I know. We both know that. Yeah. Say Western, please. Thank God. With Guerrero, Leroy. Yeah, that's good. Good to see you.
You good?
Yeah.
Congratulations on the baby.
Thank you.
I'm happy that, I'm happy for him. Really, really happy for you. Just take care of the baby,
I will.
Thank you.
Thank you.
She's still not here. Okay. And then I'll try calling her and I'll let you know what she said.
Okay.
If I get hold of her. Okay. Well, how much longer will it take for you to get here? So you know what? Go ahead and come on in, and we'll fit you into the schedule. You might have to wait a little bit longer because we'll fit you in between patients. Is that okay?
This is great. Oh, I know. Look at this. Look at this. This is so cute. Newborn. Hi.
Can I come in?
Yes.
Okay.
I got an apartment, Dr. Stock.
You did? Well, that's good news. That was going to be one of my questions. If you had better housing by now.
I just got the keys today.
Oh, great.
So I signed the lease, and then
exciting.
it's like this much. That's why I was running late, and I was like,
oh, well, that's a good reason. And that's a place you can stay, right? You can stay there with
yes,
the baby.
for 2 years.
Oh, wonderful.
They want a success story, so they're not housing me to watch me go back. Okay, bye, under the bridge again. They wanna place me in a permanent housing, like permanent house. Everything's
Congratulations. I'm glad
Thank
it's working
you.
well. And your son is pretty impressive for you.
Yeah.
Well, good for you. And how is the pregnancy going?
The pregnancy is going well. No pain, no nothing. I'm doing great.
Yeah, we were thinking it would be nice to simplify the regimen.
Right.
And we were so excited when your viral load became undetectable so quickly.
I get so confused. The viral load,
That's how much virus is in your blood. We want that to be undetectable. Initially, it was here. I have it written down here. Elia was diagnosed positive in early pregnancy, and because we wanted to try to find a regimen that's going to work quickly, we chose this regimen, which is a bit more than we would ordinarily give, with Complera. And then we combined that with raltegravir.
In Elia's case, the combination of drugs can actually block viral replication enough so that an infection doesn't occur. This is an example of how the multiple drugs can actually target different parts of the virus. Complera, we have a combination of 2 nucleoside reverse transcriptase inhibitors and 1 non-nucleoside reverse transcriptase inhibitor. Nucleoside reverse transcriptase inhibitors work by tricking the enzyme into incorporating them, but they prematurely block the chain elongation that's required. The non-nucleoside reverse transcriptase inhibitors can bind to the enzyme and cause it to have a distorted binding of the nucleic acid in such a way that the chain extension can no longer occur. Icentrus is an integrase inhibitor and can actually bind to the active site of integrase in such a way that it can no longer insert the double-stranded DNA into the host cell chromosomes.
She had a really good response. The viral load decreased very rapidly, and we were very encouraged by that. So we discontinued the raltegravir, thinking Complera by itself would be good enough. So we checked the viral load again, and her viral load had gone up a little bit. We were very disappointed. Before you started treatment, it was more than 92,000. Okay. So you started treatment, and very quickly it became undetectable. And then we stopped the Icentrus, thinking that wasn't necessary.
Right.
And then it went up a little bit, 589. That's not bad. Right. But we wanted to be undetectable again.
Right.
So that's we decided we're going to keep her on this regimen until she delivers, and then we could look for something a little simpler, because the goal would be to be on a 1 pill once a day.
Are you out of them, or did you just forget?
No, I forgot to take them. Yeah, those are it.
Okay.
Adherence is always a problem, and 1 pill once a day greatly simplifies adherence.
If patients don't take their medication daily, HIV begins replicating. Every time the virus replicates, there's a chance it can mutate and become drug resistant. For example, when patients are treated with drugs that target HIV protease, most of the viral particles are destroyed. But rare mutant forms of the virus, like this one, resist the action of the drug and survive. These mutant viruses make a mutated form of the protease. This protease resists the binding of drugs, but can still make the necessary cuts in the viral protein. This is why the most effective current treatment method uses a combination of drugs that attack the different enzymes.
This is why it's so important to make sure that the patient takes all her medications, make sure that the insurance will cover all of them, that the pharmacy will dispense all of them, that they're given in the correct dose so that they don't have inadequate levels of the drug to fully suppress viral replication.
Any missed doses at all?
No.
Okay, and you're taking morning and night?
Yeah.
So when you have the baby, things get a little crazy. Okay. The baby's also going to be on meds. Do you remember how many times a day?
No.
Have you talked to the pediatrician already? Sometimes it's really hard to remember to take care of yourself and to take care of your meds when you've got the baby. So if you want to change the time that you take your medications so that it's the same time the baby gets her medications.
Yeah, I want to make it the same so that I take my medications.
Yeah, because otherwise it's 4 times a day you have to remember, but really if you just change your schedule so it's the same as the baby's, then it's only 2 times a day.
Okay.
So
the setup that we have at our maternal child adolescent center is very helpful. We have the social workers. I talk to the social worker every day, and the psychiatrist is right there, and the pharmacist who's been very helpful here. I think that this type of a setting is really ideal for patients such as this.
How's your diet?
My diet's great. I'm making a lot of smoothies, orange juice and apple juice.
How many of those do you do a day?
I've been doing one.
One?
I've gotten better. I was doing like 3 a day.
Okay.
So
yeah, cut it back to 1. A cup of juice a day is okay. And the rest should be water.
So how are you feeling?
I'm feeling good. I've been sleeping good.
Well, good.
Everything's
Take
good.
advantage of it while you can.
Yeah. This pregnancy went by so fast, you know?
You're 34 weeks now, so another 3 weeks and you're full term.
I know.
Yeah.
This is like,
Yeah,
yes.
and then it could be another 4 weeks after that, which would be on October 3rd. September 5th to October 3rd would be normal.
No, don't even bring up October. That's like, that would be like, what? I think I'm gonna give birth before.
If you're not delivered by then, we will induce labor.
Okay.
So you had some labs last time. Let's review
Oh,
those.
that's right.
Yeah. Okay. Well, the most important thing is the viral load, which was undetectable. That's
Again?
Good. Yes, that's good.
He
That's
breathes,
good.
yeah.
Yes. We also did a drug screen, which has been negative each time we look.
It's like illegal drugs? Yeah, right. No, I'm not even doing anything. No,
Right.
no.
So it's good to have those in your record.
Yeah, I don't do drugs when I'm
No.
pregnant, but yeah, yeah.
Good. Don't do them ever.
Yeah.
Now, the father of the baby, has there been any more contact with him?
No, nothing. Everything's, you know.
He doesn't know where to find you?
No, he just has no idea where to find me.
Well, that's good.
That's how it has to be. I think about using drugs and I think of failure. Those days without showers, those days when I was hungry, stuck in that area, I don't ever want to go back there.
Some of our patients have made remarkable changes in their life, and very often pregnancy is kind of a catalyst for that. Pregnant women are willing to make changes, and if they can continue those changes, they can change their lives.
I get to stay here.
Oh, this is really
This
sweet.
is my home sweet home, Ursula.
It's sweet.
Okay, so I got the car seat ready. I got the stroller. I have everything.
Well, you'll just bring the car seat.
See, not the
with
stroller,
you.
right. Yeah, absolutely.
So, in an outfit. Well, I have some information of things that you should
Okay.
bring. So,
And then I have everything.
I think you do.
I've done it's overly done.
You're ready.
Thank you so much for coming.
Take care. Oh, you've done so wonderful. We can't believe it. I mean, I wish other women could take a lesson from you. You can survive and you can do better. You've proven that.
7 months yesterday. Homeless, and now I'm doing okay.
Yes, you are.
I don't have the family here in the city, but I have the support team at the clinic.
You're in your new place already?
Mm-hmm.
You like it?
I really like it. It's small, but it's home.
Yeah.
And you have to want out. You have to want to go sober and want to better yourself. And I'm so grateful for the clinic. I really am. Really grateful for you, for the staff, the rest of the staff. It's just great.
We're proud of you too.
Yeah. Thank you, Lourdes. Yes. I remember, from the first day that I got here, it's like, I know. I have so much to look forward to. You know, it's like this baby will be here before I know it in a few weeks. And when I first got here to now, I feel so independent.
You like to hear those stories.
Yeah, it's a success story.
Yes, definitely.
I'm really excited. I think that this baby knows exactly what's going on for some reason. It's like the timing is perfect. I'm nervous. I'm excited, all that, it's great. It's gonna be okay.
So let's lay her. We're going to measure her height. Put her all the way to the edge.
Sweetheart, she's beautiful. When did she go home?
She went home last Wednesday.
So she's approximately 2 weeks old today, right?
Yes.
And how did she do this weekend?
She
How
did
you doing
great.
with her?
I'm doing good. I give her medication out every day at 11 a.m. and 11 p.m.
Yeah, okay. I looked at the baby's lab work already, and the first DNA is negative. That's the birth one.
Okay.
We'll be drawing one today. We'll draw one in 2 months. The baby is nice and chunky.
Yes.
I looked at her growth. She's at the top of the curve for height and weight.
Right.
So looking good.
Okay.
I'd rather have a big baby.
I have met great people because I was diagnosed with HIV.
She looks so serious. Yeah. Oh, she's really alert.
Yes.
She's always so quiet.
Always. She is a really excellent baby.
I'm not
From the beginning, I thought this baby wasn't going to be HIV positive.
Oh, look at that.
You can't consider yourself a victim. You can't be beat.
Smile, but I need to cry.
I have so much to live for.
For the first 15 years of the epidemic, it was kind of like being the first responder at a train wreck. And it was very traumatic. It was an awful thing.
There was no approach to preventing infection, and there was no treatment for someone who had HIV infections.
Those patients that could not actually come to the facility, we went to them. That's what we were looking at during that time. It was horrible.
Can't tell you about the countless young men who were my patients who died of AIDS before effective therapy was developed.
So it has come a long way since the beginning of the epidemic.
Hi, how are you?
Good, and yourself?
Great. Have a seat, Marcos, so we can talk a few minutes.
My name is Rochelle Rawls. I am a physician assistant at the Rand Schrader Clinic, and I've been here for the last 23 years. My specialty here is infectious disease, HIV and AIDS care. And I am usually the first person on a new patient visit that the patient sees. And so I let them know, today, this is not a death sentence. So tell me about you and why you're here, and just give me some idea of who Marco really is.
I'm 28 years old.
Okay.
I'm with somebody, been with that person for almost 4 years.
Okay.
That person got diagnosed with HIV, and he didn't tell me.
Okay.
Which is why I'm here.
Have you had any symptoms that might be suggestive that you might be positive, like a cold that you couldn't get rid of, any type of rash on your skin, night sweats or chills, none of that?
None of that.
Okay. If you're having unprotected sex, not only HIV is what you could possibly have contracted. I want to do some series of tests on you just to see, number one, we're going to check you for syphilis. We're going to check you for gonorrhea and for chlamydia. After we get all those tests back, which will be in about a week, I'm going to sit down with you and I'm going to go over every test. And we're going to talk about it. If you are negative, you will start PrEP if that's something you decide to do.
Okay.
And let's see what happens. I'm interested and I'm curious to see where you're going. Because where you're going is going to be so much better than where you are right now. You're in a dark place, but fortunately, you're here now.
Yeah.
Okay?
Yeah.
So it's, like I said, it's a good day, right?
I feel like it is.
Yeah.
Like something told me to come.
Yeah.
Like I wanted to. I was determined to be here.
Yeah.
And here, I appreciate it.
All right.
Thank you so much.
You're welcome. We're here not to cure it, because there is no cure, but to start healing a process that not only starts on the cellular level, but starts in the heart. that starts in emotions and wounds that have been open in your life for years.
When I got here yesterday, I was like shaking. I was so scared. I didn't want to come inside. I wanted to go home. But after talking to her, you know, I felt better. I'm not even nervous at all.
All the way up?
She made me feel so at ease.
When the test first came out in 1985, there were many people who declined to take the test because there was nothing to do about it.
But now you've had the opportunity to be diagnosed, treated, and to live.
There are younger patients with HIV on medication who never experienced the complications that those older patients did. And more recently, we see lots of young men who are HIV negative and looking to protect themselves with PrEP.
Today I'm here to pick up my PrEP prescription.
Have a seat right there.
HIV is common among gay men. And so ever since like I started having sex, I was always really scared that I would get HIV.
So PrEP is pre-exposure prophylaxis. In other words, a person who's HIV negative, taking a tablet every day, hopefully using condoms as well, to prevent acquiring HIV.
Robert, he's very educated about the disease process. Most of the patients don't come in with as much information or questions.
I think being on PrEP like helped me not freak out because like I know that I have a lot of protection against it because I'm taking this pill daily. So that's why I do it.
Hi, Robert. How are you?
Good. How are you?
Come in, have a seat, and let's talk about Truvada. This is your prescription, and it's Truvada, 1 pill daily. You have 30 pills. It's imperative that you take the medication daily. And I always tell patients, if you take it at the same time every day, it's more of an assurance that you'll be compliant versus taking the medication sporadically. Does that make sense? Mm-hmm. Okay. And make sure you hydrate, drink a lot of fluids. Okay. Okay, because it can have a negative effect on your kidneys. Mm-hmm. Okay. All right? Do you have any questions?
No.
All right. Charge you for the
At this point in time, there's only one medication on the market for PrEP, and that's something called Truvada, that consists of 2 antiviral drugs in a single tablet.
If the Truvada is present at a sufficient level, it is effective in blocking the replication of the virus. HIV contains critical components known as enzymes that carry out the chemical reactions that are required for the viral infection to occur. Reverse transcriptase, for example, carries out the copying of the viral RNA into a double-stranded DNA form. So Truvada is a fixed-dose combination of 2 reverse transcriptase inhibitors that are known as nucleoside reverse transcriptase inhibitors. The components of Truvada mimic the normal DNA building blocks, but once they're incorporated, they block further extension of the DNA chain.
So this is one of the most amazing chapters in the history of medicine, certainly in the recent history of medicine, where we went from finding a disease that was unknown to understanding that it was caused by a virus, to understanding the molecular mechanisms by which the virus damages the immune system, and then the amazing process of drug discovery that led to an effective therapy, all within 15 years of the discovery of the disease itself.
How did you feel about taking the medicine?
I get really, really nervous when I have sex with someone. So that's why like being on PrEP, it helped me. I didn't get as nervous.
So you said a couple of days ago you ran out of meds. Mm-hmm. Have you had sex?
No.
Okay, good. Now those times in which you did have sex, did you use condoms?
No.
Okay. So tell me, what was your mindset in regards to that? Did you guys discuss the process of maybe not using, or?
I mean, we were both on PrEP, and I felt pretty safe doing it with him, so.
Okay. I always tell patients that regardless to whether or not you're on PrEP, he's on PrEP, he's on HIV medicine, you're on PrEP, whatever, you need to use condoms. Because you're not just dealing with HIV and AIDS, you're also dealing with other STDs.
Now, the one thing that I would say to you, you may need to think about using condoms as an option versus the medications. I know you just explained to me about that fear that you had several years ago in regards to having unprotected sex, and you didn't know whether you were positive or not. But you still, the recommendation is to use condoms for that double assurance, okay?
Yeah.
I think you're doing fabulous. I just want you to make sure you take it daily. Okay.
Mm-hmm. I think Rochelle is great because she's not like judgmental or anything about like being gay. Like I think some doctors, you kind of feel afraid to talk to them because like you feel like they're judging you and they're judging your sexual like behavior, and I don't think that she does that, so that's what makes her awesome.
All right, I actually have a bag of condoms for you. So just in the event, you have your condoms available.
Okay.
Thank you. All right, have a good one.
You too.
All right. Bye-bye.
We've lost in medicine connection, and we've lost conversation because we're so busy getting numbers out. I got 20 minutes to see X amount of people, and if I can do it in 10, that's even better. But we've lost that connection.
Hi, Marcos. How are you?
Good, and yourself?
Oh, beautiful. Thanks so much for coming back today. I just wanted to go over your lab results and just confirm the fact that you are a candidate for PrEP because your HIV test is negative. So that's great news, huh?
Definitely, thank you.
Yeah, that's great news. So the literature indicates that there is a 99% coverage or a chance that you will not get HIV as long as you take the Truvada every day. But I also say, as well as use a condom, because we want to prevent all STDs, not just you getting HIV. Make sense?
Correct, yes.
I'm going to examine you real quick. And then you're going to get your prescription and you will have graduated to the PrEP team.
The way she treats people and she talks to them, it makes you feel even better, you know what I mean? You know, when I was coming, I was like, whatever happens, happens. I have her support.
Could you put that on top of that for me?
I remember the first time I met her, she was just telling me about like all the people who she's seen like affected by like HIV, and she just seems like she cares a lot about what she does.
I'm not looking at my computer. I'm not typing. That amazes them that you actually listened to what they were saying and you've connected. When you start talking about the things that are important to them and you connect and you're able to reference that when times get a little tough, you win as a provider.
Well, I've been fortunate in being in the field long enough to see things get better. You know, from a time that the dark ages when people died daily. And I remember people back then who so very much wanted to survive. I used to say that my wish was to grow gray with my patients. And amazingly, that wish came true.
So I would say to a medical student that's possibly interested in going into HIV and AIDS is that you will never be sorry for the decision you make, because it will be life-changing more so for you than for the patient.